nodule. So definitely once we'll cut there and there is some kind of the nodule over there to understand each and every acupuncture point. So this is iterative medical acupuncture anatomy. There are the 361, all the acupuncture points. They have done the cross section and where the acupuncture point is located and which muscle the point is located, which nerve that point is located, which artery that muscle point is located, which vein that acupuncture point is located. So we all know, look at about, we normally practice is the Yang Ling Chuan, that is GB34. We apply for all the patients most of the times because it is the communicating point to the gallbladder and then stomach. So therefore, stomach controls the soft muscles, gallbladder controls the hard muscles. So to combine together, we use that is the GB34 at the same time. So why is it so? Which point that is, in fact, that is applicable to the common peroneal nerve to be activated, right? Where the common peroneal nerve starts from the back, and then from there it is a superficial peroneal nerve, and then the deep peroneal nerve, it starts from there. Then the inferior lateral to the genicular artery, it activates to the genicular artery. When the patient gets the pain relief for the heel pain, then you understand it is related to that artery you are opening. So once you talk to the doctor, the medical doctor who are coming for you to take the treatment, because they do required, we should go and they should come. So then you say this will going to happen through the acupuncture. Certainly they will come to you and take the treatment. This will be the evidence for evidence for all the acupuncture points are located. So I'll shake this and please you just change the slide. Where is monitoring? Yeah. So now there are the importance about this. According to the scientific evidence, the NIH, the Accreditation Council for Acupuncture and Oriental Medicine. So what exactly is the Oriental medicine? What exactly is the Eastern medicine? There are the two types of the medicines. One to be known as a modern in USA, they say that Oriental medicine, which is related to the acupuncture, moxibustion. But moxibustion is prohibited in USA. So only they use the electrical moxibustion, not the Artemisia vulgaris. They don't use it, by the way. And at the same time now herbs they use, physical therapy, meditation, of course cupping. These are the modalities to be known as a Oriental medicine. When we understand about the Eastern or Asian medicine, of course all we know there is the acupuncture, moxibustion, tuina, qigong, feng shui, cupping modalities. Now look at about the various British Acupuncture Council, Canadian Acupuncture Council. When we understand about the PubMed, in the PubMed 33,000 nearly the acupuncture and the traditional Chinese medicines articles are existing. No other Indian system of medicine are having that much articles in the PubMed. We all know the PubMed is the place where the authenticity of the research to be published in that. Of course, nearly greater than 33,000. Please next, it will take some time. Of course, this is how the acupuncture will get relief for the pain pathways. This is very imperative if we understand. So the signals when we wanted to apply one acupuncture needle on this specific region, we all know there is normally people says the pain relieving point is Hoku. Hoku means Li4 and the knee thing ST44. But where should apply? Whether should apply on the same side or we should apply on the other side? Other side application will be most powerful. The traditional Chinese medicine says when you have the top diseases, treat down, vice versa. When the right side problem, treat on the left side, vice versa. Because when you look at about the general pain pathways is the perception, modulation, and then these are the transmission of the pain. Once you insert somewhere is the needle, the energy moves to the spine. From the spine, it crosses the commissioner of the spine. It goes to the other part of the brain, to the somatosensory cortex of the brain. From here, you get the signal say that you're having the pain here. But therefore, when we wanted to apply any points, for example, knee pain is there on the right side, knee pain. treat on the left side, vice versa, also possible. Because you can use what are the difference between these two. Once the patient is complaining right knee pain, of course you are applying the points on the vicinity of the knee region. So that time it increases the chi and then microcirculation on that specific region in order to dilate the blood vessels and then muscles. So when we wanted to apply the other side, because other side giving the command, the problem is on the right side, but signal is giving from the left side, vice versa. So therefore give the other direction where the hemiplegia, paraplegia, hemiparesis, Bell's palsy, we normally treat the patients on the contralateral side, other side of the problem. So that time that works to the brain, even for the pain also, which we called as a somatosensory cortex in the brain. So it releases certain chemicals. What kind of the chemicals it releases? Of course is the endorphin, encephalin, enkephalin. These are the hormones will releases from the brain, which we called as the opiates, natural opiates. The patient is complaining about the pain. After the acupuncture, for example, I can say when there is the one particular point for the UB40 is the Wei Chung. Wei Chung is the point, acute lumbar pain. Once you bleed, the patient is only you are applying the needle, that doesn't have much effect. Once you bleed that point, certainly that have the impact on communicating to the spine. From the spine, it goes to the brain. From the brain, it releases the certain chemical substances like endorphin, encephalin. So that time the patient feels instant relief. So therefore, of course, so each and every acupuncture point, once you insert, because when we use as a multiple needles or the single needle having the great importance in order to patient get relief, but right point to be selected, that's important, imperative is the key. But of course you understand when the patient is having the right headache, apply on the left side. We know the tongue acupuncture. So in that there are the 2 points, the Lingbao and Thai Pai. That is 2204, 2205. So once you apply these points on the opposite side, within 30 seconds, inshallah, patient get relief for the headache as well. Right. So therefore we wanted to learn something is the different. Please next slide. So now we understand about the Journal of Acupuncture and then Meridian Studies. It says that does acupuncture or the pain functional connectivity in the central nervous system. Of course accepted in 27 number 2015. That is Journal of Acupuncture and Meridian. These are the international journals which is existing. Of course when we wanted to treat scalp acupuncture is the 12 different types of the scalp acupuncture is there. When you wanted to treat for the long-term diseases can be treatable. So that time you are giving directly command to the brain to control and regulate with the support of the pituitary hypothalamus. So therefore that has been proven when the acupuncture having the longer effects, longer relief through the central nervous system. Next slide. This is the evidence. When another meridian which called a Journal of Acupuncture, Meridian and Studies. So this also says, so you understand the Cochrane library, the PedPro, PubMed, Scopus, Sport Discuss and Web Science. You understand this is in fact 70 million articles are existing in this Scopus. Remember, related to the health, 70 million articles are existing health related. Out of it, acupuncture also existing. Even all the practitioners, myself or anyone, of course when we wanted to submit to the Scopus. So that time it is the right time without any charges at the cost of free. We can publish our article in the Scopus. Maybe you can keep it in your mind when we wanted to do some publicity. Of course, when we wanted to do the project work, synopsis and dissertation assignment. So that particular time it is essential for all of us. Once published from any journal, that's really imperative. When it is possible in the PubMed, even it is possible to do that in that journals as well. When we look at about the Sinhal, Cochrane library is the great library where the authenticity is 100%. So therefore, until they don't have the purity and originality. Next slide. Then types of studies, there are the 2 types of the studies. One is the randomized clinical trials. The other one is the specific clinical trials. So two ways. When the patient is coming, then you have taken 100 cases for the knee pain, and then you are treating for the same points. Knee pain is Yin Ling Chuan, Yang Ling Chuan, Susan Lee, Sanin Jiu, you are Tai Chung. You are using the same points. But you treated 100 patients by using that points. Using the clinical acupuncture is different from the classical acupuncture. So now clinically you have done 100 patients, then what is the scale? When the patient comes to you, VAS, Visual Analytic Scale. In that, what percentage patient got pain? It is 70% pain, or 100% is the excruciating pain, or 50% pain. Then how the pain has been subsided after 12 treatments, after 15 sittings. However, whatever you wanted to do, maximum you make it the plan. 12 to 15 sittings maximum you should do. Is not that 20, 30, 40, 50, 60 treatments you are giving to the patient. That one way is not good. We need to change the modification and lifestyle of the patient in order to feel the healthy forever. That's very imperative. The other modality is called as a specialized clinical trials to be done. When we take up the knee pain is the second category. So in that category, every time acupuncture points get differs, not the same points. Today what it says, according to the body constitution, the chi and then blood, where it is excessive or deficiency, that to be changed. How the judge sir said back to balance. I think Zarina also here, right? So therefore, how to bring back that by using the activation is the right point. That is called as a specialized clinical trials. Make it these two different categories. When you are in the confusion mode, you could not able to, couldn't judge the diseases. That time you can do as a randomized clinical trials, whereas in specialized also it can be possible. Definitely this will be. So when we wanted to get the acupuncture recognition in Kerala or Karnataka or Tamil Nadu, so on, when it is essential, how many of them you are around 3,000 or 6,000 practitioners are there in the state. Then what are the evidence how many people have been treated? Yes, of course, I do have the record in my center that I have treated so many people. Give me the evidence, what kind of the report you do have. So therefore, what points you selected, what percentage the patient got the relief, and their contact details, certainly that will be impacted in order to submit to the government to get the approval for the acupuncture. Thank you. Next. So now we understand about I think this I completed. Next. So now the investigation of the acupotomy. This is in fact is totally different. Acupuncture is different from the acupotomy. Acupotomy is one kind of the needle. Acupuncture needle, whatever we use, substandard quality sometimes. Be careful. When we wanted to practice, use the FDA approved acupuncture needles is always good. But sometimes FDA is not approved acupuncture, but FDA is approved only the acupuncture needle. That's so bad, right? But by the way, if we wanted to use the quality of the needles, then FDA. But however, when we wanted to use as a acupotome, newly invented, Professor Dr. Su invented 30 years ago, there is a knife acupuncture. You understand how the scalpel blade we do the cupping, right? In that way, the sharp edge having the knife of the needle, through that knife we do the stimulation. This is very painful procedure. The most of the times are the professional doctors, they do the procedure, periarthritis of the shoulder. So that particular time they insert, first they do the anesthesia and then they apply the needle to stimulate that particular point. That is something is amazing. Acupotome is kind of the needle is here. Next. Then we understand about the therapeutic method. So now you understand there are the 30 minutes, 2 to 4 hertz. This is the evidence-based, where the neon, dubi, that means is the eye of the patella points, and GB34, ST36, what I told you is the clinical randomized trials. They have done the maximum the patient in 2 to 5 days, and within 3 weeks have the excellent results by giving with stimulation as well. This says is there is some kind of the evidence, of course, is existing. Next slide. When we wanted to submit to the government, we should submit the evidence-based. Acupuncture is ineffective for the knee pain. One is the macro acupuncture, the other one is the sham acupuncture. Sham is nothing but wherever you close your eyes and then apply the needle. Right, that to be known as a sham. There is no acupuncture point over that region. But generally that also having some ineffective. What is acupuncture point? I told you, having the more electrical high conductivity. Where there is no high electrical conductivity, the chances are very less to get the patient relief. Next. Then which we called as the acupuncture really is ineffective. Of course effective and then ineffective. There are the certain cases. This says acupuncture will be useful for all the cases, but I don't believe sometimes the patient feel ineffective. कुछ लोगों के लिए असर नहीं होता है, कुछ लोगों के लिए कम असर होता है, कुछ लोगों के लिए 75-80% the patient will be benefited. When you understand, when you start treating the patient, if the patient is happy around 6 sittings is over and he is telling, okay, I am good. In 6 sittings he is telling, doctor, I came today for my hand pain, and the patient says, I have pain on my left side also. When the patient is coming on the next day he says, I now have the whole body pain. Third day he is coming, then he says, doctor, I do have very fatigueness and lethargy. If he says in 6 sittings, don't continue the same treatment for him. Ask them to change the modality of the treatment. No, you come for the 20 sittings, you will be all right. Absolutely, sometimes I feel nonsense. Why we should make them to taking the time and spending and physically, economically, socially. Why we wanted to disturb the patient when the patient is not comfortable. So there the patient feel ineffective. Certainly we need to change the modalities of the treatment. You understand? Chen Chu. In China, they says as a acupuncture one is not the system. They says is the Chen Chu. Chen is the acupuncture and Chu is the moxibustion. Together, even the simple question, the Ni Ching book says that even 50% of the diseases can be treatable by using acupuncture and 50% of the diseases treatable by the moxibustion as well. When there is acupuncture is ineffective, then change the modality by using moxibustion as well. Of course, in this season, acupuncture is recommended, moxibustion is prohibited because it is so much perspiration and sweating, by the way. Next, please. So now your trigger points. This is something is different. Now I am talking about the dry needling and then acupuncture is something is different. Where the modern medicine, USA and then other European and France countries are practicing is the dry needling and then acupuncture by using the trigger point. What exactly is the trigger point? Of course, in Chinese they says is, oh yes, ouch, I have the pain. So that indicating, yes, you do have the pain on the specific region. You touch and feel on the back region where the rhomboid muscles having the tenderness which causing the shoulder and then cervical pain. Touch and feel where the patient having the pain. Touch and feel where the muscle knot is there. There is a spindle of course, patient says, I do have the pain. So that particular place itself, insert the needle. Not necessarily is required acupuncture point should be inserted. Without acupuncture point also, if the patient is complaining on the nodules, you just apply the needle. When the patient having the complaint about the Baker cyst, even today 50% of the female who come for the knee arthritis called as a osteoarthritis. So you cross check with them on the back of the knee. Certainly they do have the cyst. That's called as a Baker cyst. That's called as a popliteal cyst. So that cyst is, of course, that is the tender area patient feel the pain. So that time take the hot needle, fire needle, ignite the needle in the hot level and then insert quickly and then withdraw the quickly. Insert deeply and then withdraw quickly. Certainly within the short span, the people who are suffering for the ganglion or the lipoma, 1 or 2 places lipoma is there, you can use it, or the popliteal cyst or the ganglion is the right way. When without surgery, the patient can be benefited certainly once we insert the fire needling on that region. So fire needling is another modality of the treatment. Next, please. Then we understand the depth of the needle insertion is very, very imperative. You understand when we wanted to apply the Chung Po is the LU1 needle here, because lot of muscles are there that will damage to your pulmonary system, lungs will damage. So what depth is required to insert the needle is the key. When you wanted to apply, I'll give you one example, Sun Lee, stomach 36, when you apply on the skin surface, that works for the stomach. When you apply deep, that works for the spleen. Then further deep you apply on stomach 36, that works for the heart. When you apply further deep, that works for the lungs. Once you apply further deep, that works for the liver. You go further deep, so where insertion, it goes to the outside of the muscle, from the stomach 36 to the GN muscles, gastrocnemius muscles, that you are activating to all the organs in our body. That is the beauty of the insertion of the needle. No sir, I just apply superficially. My master said the acupuncture meridians are existing skin surface. Of course I respect all the masters, but by the way, the needle insertion is very imperative. When you insert to the deeper level, the tibial, now you are activating anterior tibialis muscle, the foot drop is there, that time you are activating to the deeper level, not on the skin surface, it doesn't work. Of course, only related problem. So therefore, whenever you wanted to apply Huantio, GB30, the deeper level is required. When you wanted to apply the Tai Chung liver 3, that to be connected to the K1 point. So K1 point you inserted, that is applicable to the liver 3. So therefore, you are combining together through needling, one acupuncture point, and we are 3 acupuncture point, we are using one single needle. Likewise, the through needling having the more effective than the other needling. Right, next please. So when we understand about the currently acupuncture, UNESCO also approved and recognized in 2010. We all know that. Next please. Now the American Academy of Medical Acupuncture, needling having the effect of the nociceptive, proprioceptive and autonomic nerve pathways to increase the enkephalins and dynorphins in the spine, midbrain and raise the endorphin and hypothalamus pituitary region. 2 points I'll tell you to treat for the pituitary and then midbrain. This called as a Sun, that is Sanjo 20. SJ20 or triple warmer 20 is the good point to treat for the pituitary hypothalamus. When we wanted to treat for the midbrain, that point to be known as a Tian Chung, that is gallbladder 9 point, GB9 to treat for the midbrain. The people who are suffering for the epileptic fits today causing the problem for the miserable of the life, and the patient getting the fits that is related to the temporal region. When the most of the epileptic convulsions fits are causing the problem related to the temporal region having the problem, treat for the temporal region to get the relief for the hippocampus and then pituitary hypothalamus, and also for the midbrain to regulate the current waves, which is electricity will be more, that to be regulated by activating these points. Then the midbrain I told you, GB9 is the LI11 normally we apply. Immunity it increases. Why is it so increases? Only the Yang Ming. Yang Ming is the stomach and then large intestine. Together having the chi is get excessiveness and then the blood also get excessiveness. Together the chi and then blood more to be excessiveness. So that particular time having the cooling effect to our body system. Which point it cools our body? Of course is LI11. Also it cools our body. At the same time it has proven that endorphin exists in the immune system. Of course the substance P, and this is substance P, so which is causative factor for inflammation in our body. When the patient is hurted somewhere, I hurted somewhere, so that time that signal, that substance P, it releases, which causes the pain. So to suppress that pain, the endorphins are required. The endorphins are released by the pituitary hypothalamus. Next. Now we understand about the C-force is the primary gene protein that marker of the increase the metabolic activity accompanying the messenger ribonucleic acid increases the brain cells, which explain the long-term effects of the acupuncture. The messenger's RNA will be released by activating the scalp acupuncture. Of course, when we wanted to apply based on the Brodmann areas of the scalp, this is required to all of us. What is required? Of course, try to understand what function of the frontal lobe, what function of the occipital lobe, what function of the temporal lobe, what function of the parietal lobe, what function of the insular lobe, so that we need to study. So once we study this, then the Brodmann is divided the whole scalp. Whole scalp is divided into 52 different divisions. In that divisions, each and every division having the different functions. So therefore, when we look at about the Broca's area, Wernicke's area, angular gyrus area, so which is located on the left side temporal region, it is essential to regulate the voice related problem when the speech related disorders and the speech is understanding couldn't speak that particular time Wernicke's area. So paralysis patient, when the right side paralysis affected, of course left side Broca's area will going to damage. So that particular time for the long-term relief, when we wanted to increase the brain cells, of course for the long-term effects can be done by using the acupuncture related to the scalp as well. Next. So because we each and every system, I am giving you only the skeleton. It is essential to study years together, months together it is required. So next please, involvement of the opiate receptors. So decreased the EEG abnormalities and seizures were accompanying by the decrease of the RNA and enkephalins dropped by the dynorphin. You understand when we wanted to use some of the points on the brain, because I am giving you more emphasis on the brain, because normally we used to apply some of the points which is related to the Taiyang and then Shaoyang meridian acupuncture points, which is located Sansu, Mi, Ching, Chu, Chai, Wu, Chu, Chu, Cheng, Tian, Su, Tian, Shu. These are the points that are existing on the scalp brain region. These points are really imperative treat for the numerous disorders for getting the long-term diseases. Because when we understand, so there are sometimes we don't understand which area is governing. So when according to the somatosensory cortex of the brain, according to the motor functions of the brain, when we understand, then we keep applying that particular area, targeted area, to get the long-term effect. The hippocampus to be released by using the point to be known as a Shaku. GB8 is the good point to treat for the hippocampus. So therefore, when the hippocampus is releases, then the people who says is the short-term memory, long-term memory issues, of course, that can be treatable by activating to the brain, on the scalp acupuncture points. Of course, you wanted to know more about the acupuncture meridian. Nearly 250 videos are there in acupuncture only related to the different topics. So if possible, with the permission of the organizers, you can prescribe, you will get the great knowledge about the acupuncture, each and every acupuncture point. I can discuss you only the liver 3 and then liver 2. 2 acupuncture points is treatable for the hypertension and diabetes. Only 2 points I have given the lecture on that. You can see amazing how will be useful for that particular diseases. More than 30 minutes I have given talk with the evidence-based applications treating for the diabetes mellitus and hypertension. So that kind of the knowledge you can derive from our channel. Of course, if you are interested, please proceed. Next. The de-addiction related problem, the people are suffering for the various diseases related to the smoking, alcohol, metal chewing, so on, gutka. So that there is the NADA. NADA is the National Acupuncture Detoxification Association in USA. It is existing. That association is giving the 5-point protocol to treat for the de-addiction for all the diseases. The patient who wanted to stop smoking, who wanted to stop alcohol, certainly you can use the point to be known as a Shenmen and a kidney, liver and lungs and sympathetic points. So if you add these 5 points for the people who are suffering for the addiction, certainly they are having the great relief. They can overcome this problem. They can give up this problem. Certainly, you are not only saving that person, but you are saving to the entire family. So please, you just follow. If anyone wanted to become the member of the NADA, you just register that in that NADA association. You will get the membership certificate from the USA. Next, please. So now we understand about the adrenergic effect and cholinergic effect of the acupuncture. There are the two effects of the acupuncture. One to be known as the cholinergic, how the drugs are essential for emergency. So in this way, acupuncture also works as an emergency as well. When we wanted to apply some of the points, you understand the sympathetic and parasympathetic, I told you, the sacrocranial outflow, the sacrum problem, and this is the cranial problem and then sacrum problem. Together is treatable. That to be known as a cholinergic drugs. Cholinergic drugs, how that will work in the similar way, acupuncture also works. When the anticholinergic, or which we call as a dopamine, it releases certain the dopamine, serotonin, and the pituitary, through the pituitary hypothalamus, and the lethargy, infertility can be possible to treat. You understand, this is in fact is the imperative. Sacrum, and then sacrum is treatable for the pelvic problem. You treat for the Chi Mai, Chung Chi, Ren acupuncture points, no Ren acupuncture points. Of course, you can use it. Only one acupuncture point can be treatable for all the pelvic female problems. You understand, there is the Pa Leo, Pa means is 8, Leo means is the points. Shang Leo, Si Leo, Chung Leo, Xiao Leo. Bilaterally, both the points are located. Only one you register in your mind, that to be known as a Celio. Celio is UB32. If I am not wrong, you write down CEILIAO. Celio acupuncture point is treatable bilaterally if you insert the needle in the second sacral foramen. Second sacral foramen, insert deeper level. That will be useful for all the male and female related disorders, because that has been proven in China. That will be useful for all the urinary bladder related problems, can be treatable. At the same time, then you wanted to treat on the cervical region. Of course, the 2 tune above the DU14. 2 tune above the DU14, insert on the midline, certainly having the great impact. The patient feel lot of changes for the cervical brachial pain, that also having the cholinergic effect through the acupuncture as well. Next, please. Now we understand the 24 hours organ clock theory. We all know when we wanted to apply appropriately, when we wanted to use the point in that particular time, when we should apply. So this is, I think, please give the attention. If your mind should be here and then body should be present, so that you can understand some of the one concept I'll give you. Based on that concept, the patient should get 100% relief, inshallah. So that particular time, use the proper time according to the organ clock theory. For example, Chiza is equal to Folio. LU5 is equivalent to the K7, right? If you apply K7 or LU5, both are same. So once you apply LU5, 4 AM is recommended to apply the needle on that particular time. Patient can come at 4 AM, it is not possible. Then you understand K7 Folio, the organ clock timings of the kidney is 6 PM. Then the 6 PM, the energy is there already, but 6 AM kidney energy is weak. So 6 AM you apply the K7 or LU5, that having the great effect. So patient feel lot of changes, because that particular time, when I have the money, somebody is asking, I can give you the money, please take it. Right. If I don't have the money, then how I can give the money? By the way, this is the papers, not the money. I'm very, I don't want to give my money to anyone. Sorry, this is as a kidding, right? So therefore, when you wanted to apply in Ling Chuan, spleen 9 is equal to the K3, Tai Chi. So spleen 9, when should apply? 10 AM, you just apply the needle 10 AM. If the patient is not there at 10 AM, is equivalent to the kidney 3. Kidney 3 timings are 6 p.m. having the more energy, but morning 6 a.m. having the less energy for the kidney. Use the 6 a.m. in the morning. I'll give you only last example. For example, you just use the liver 3. Liver 3 is the grand sun point, is the sedative point when the liver timings is the 2 a.m. in the midnight, and 2 a.m. it is not possible. Liver 3 is equivalent to the spleen 1, that is in pi. So spleen mother, grandmother point, then the spleen mother timings are morning 10 a.m. Then the 10 p.m. it is recommended. So this is required some calculations. If you know the organ clock theory precisely, even I have written the dissertation thesis of my PhD related to the time-bound sensitivity itself. Each 60 command points having the particular time to treat the patient on a specific time. When the one time is not possible, other time can be possible. Next slide, please. So the acupuncture is the catalytic therapy. Chemical reactions to be taken place in our body system. For example, you look at about the Li11 controls the diarrhea. Right. Of course, it is useful for dysentery and diarrhea both. How that to be regulated? By giving some kind of the loperamide medicine. Probiotic medicine should give, the immediately diarrhea will control. Without that, using the Tianshu, that is the stomach 25 point you are using, that also controls the diarrhea. Then how will going to work? How the medicine will work in the body in the same way acupuncture points also works in our body in the same way. There are the certain hormones and neurotransmitters taken place in our body system. So that neurotransmitters is nothing but is the catalyte. Acupuncture is not only the needle insertion to get the relief, it also to be known as a catalytic therapy, also known as a acupuncture therapy. Next please. Each and every acupuncture point having the pharmacological actions. When the medical doctors, even I'll give one research task somebody who are the Form D, Doctor of Pharmacy, we required for our group so that they know all the pharmacological actions, how the drug will get the absorb, how will get the assimilate, how will going to eliminate in our body. So what is the bioavailability of the drug? How many hours the patient will get relief of the headache if the patient takes the naproxen hydrochloride medicine? So in the similar way, even acupuncture also works the same. But how that will going to work? But similar way, we wanted to understand if we have the laboratory, we required the ethical committee in India in order to get the proven results. When the cat and rat, they are doing the research on that in the rabbit, why can't we do the research in the human beings? So of course for which we required the laboratory, which we required the physics professor, which we required the chemistry professor, which we required the biology professor, along with acupuncture scientists. Definitely we have the research. If the national level, I request to the Atama and other people, even we can frame, already I think you people have that in the national level, we form the ethical committee. Normally we apply the DO20 is the PAI, is the releasing certain hormones. Of course the oxytocin, dopamine it releases. Dopamine it releases is the happy hormone. So once the patient feels the relaxation, how that will relax, what hormone releases in the body system, the patient feel good, that required the laboratory investigation. Today the modern medicine is increasing, is the booming level because they do have the research, they do have the plants, they spend the crores and millions of rupees, millions of dollars for the research. Of course, we do require, we are treating the millions of the people in Kerala. I think most of the people treated millions or the crores of the people, but we don't have the data. We don't know that some author, even I have the book Art of Classical Acupuncture, I have written some of the information. This point is useful for this. We see the protocol and then apply the needle for the newcomers. So how does will going to work in our body system? That is the key. However, the Chinese people, the American people, they are doing the investigation. But in India, there is no research council. Even each and every medicine, of course, before stepping into the acupuncture, National Acupuncture Council, even I have the desire, all of you think about this, the National acupuncture research council should be there. So once that council is there, let they do the research. Has been proven. Then they can implement is the National Acupuncture Council, not the Research Council. Because in Ayurveda you can see Research Council is existing. At the same time CCIM or the National Commission for Indian System of Medicine, today it is existing. Research also different, but the councils and commissions are different. So therefore acupuncture also required to understand, make them prove that yes, this is going to work, but nobody says how this will going to work, but we study the randomized and specific clinical trials, and somebody has done from the other countries, but in India we are not doing the same. So that's really required. But of course when we look at about the various techniques, about the Taoism principle, so I think time is, scarcity is there. I just see when we understand about the evidence of the acupuncture here, along with the acupuncture, what is required? Of course is the tuina, acupressure, of course is the prayers and meditation also required. At the same time, yoga and Tai Chi Chuan and then Qi Kung exercises also required. No, whatever you are eating, because what is required in our curriculum, we study only acupuncture, only meridians and then Naxaries we study. But apart from that, what kind of the food is required to tell to the patient? Two concepts. One is what kind of the calories are required to your body system, what kind of the minerals and then herbs are required to our body system, we don't know. Of course we do, even I need to study, all of us is studied. For that is IGNOU. IGNOU is the Indira Gandhi National Open University is there. Through that university, even any Kerala Open University is there. Through that university, it is essential to study the nutrition and dietetics 1-year diploma, or the certificate course in diploma, right? Anyone in the diet and nutrition study, and then you can openly tell that this is good and this is bad. There are the foods to be known as, according to the Chinese, there is the yin foods and then yang foods. When the patient is complaining about the yin problem, cold condition disorders, and you are recommending the cold food itself, then it is ineffective. What is required? Yang foods are required, so on. So therefore this is one thing. Of course is the herbal. When we wanted to form, inshallah, 5 years is the Bachelor of Acupuncture Medical Science in this state. So that particular time it is required herbal medicine as well. Because when I am studying in China, there are the acupuncture is the major and herbal is minor. When the herbal is major, acupuncture is minor, two different concepts. So in this way, when we wanted to implement acupuncture, along with that herbal medicine also required, not herbal medicine, of course something is the natural form, which is a living form is there, that also incorporated in order to get the proper results. The patient will be all right in 3 months. Why can't you make them to be all right in 1 month? So that is the key. Next please. Of course, there are the Taoism techniques, is the super techniques we understand, is the gymnastic technique and heliotropic technique and pharmaceutical technique and sexual technique and so on. So therefore, each and every technique is imperative. When we wanted to make them, I think nearly 1.5 hour video I have done related to the Taoism techniques, because that is the base. There are the two dynasties was there. One is the Taoism dynasty, the other dynasty to be known as a Buddhism dynasty. But more people are predominantly, they are following the dynasty called as a Taoism techniques only. So those techniques called as a gymnastic techniques. The next technique to be known as a, quickly forward, that is, next please. There is another technique is the massage technique. The tuina and then massage, even you can understand who studies the 5 years course, then there is the 3 years is the super specialization course to be known as a MD in tuina. They study only 3 years is the tuina course in China separately. So therefore tuina also it is part of the acupuncture treatment. Even I got a call, I think 1 week ago. So there is a tuina treatment to be given in our center. You understand, the French woman asking that. So likewise the tuina is standardly it is popularizing, but here we called as a massage. So making the massage to that particular point, NST, prickling neurostimulation technique. When the patient themselves, they can activate the certain points. Once you do the tuina, massage on that particular region, wherever you feel the knots, wherever you feel the nodules, wherever you feel the spindles of the muscles, so that particular time you just do the massage with the Volakranan process of the ulna or the thumb pressure. Of course, is the kneading with the palm also recommended is the tuina. The second to be known as a PNST, which I told you, every home having the toothpick therapy. So that Dr. Watanabe, Hiroshi Watanabe from the Japan, who invented this modality of the treatment. So without the acupuncture points, and you just activate, for instance, when the patient is complaining, I do have the pain on the specific region, for example, on the scapula region, when the patient is telling that I have the pit of the scapula pain, vicinity of this area, take the toothpick and reverse it, and then apply the area of that particular region called as a spiral motion. The spiral motion means this is like a cycle, clockwise cycle. So that multiple times doing that, certainly having the great impact. How does it work? So is it really going to work? You remember, according to the Mary Lustin, who is the author of the acupuncture, she says that when there is a pain, so numerous reasons to cause the pain, but however, generally the pain is there. That time the chi and then su and the chin, the body fluids get the stagnation or stenosis or the obstruction or the blockages where the chi is not promoting that particular region. Once we apply the toothpick therapy and then apply the pressure on that particular region, certainly patient feel the movement. Once there is a movement is happen, the free flow of the chi and then blood to be taken place on that particular region continuously, morning and night, twice in a day, to be done for a week. And certainly the patient is complaining about the knee pain, patient is complaining about the back pain and other pain, certainly having the great relief. Try to understand the pain is two types. One is the muscular pain, the other pain to be known as a deep level pain is a visceral pain. If the visceral pain or the organ pain is there, is not recommended. Only use the toothpick, you will be all right. Don't do like that. Visceral pain, try to analyze and understand what are the etiology, what is the pathogenesis, what is the root cause of the problem. Try to understand and then apply. If the patient is not all right for few days, recommend for the super specialization. You only treat all the patients, is not like that. Of course, is the people who are expert, and certainly we can ask them to change and then send for the other modalities of the treatment. The next called as all chemical techniques on that particular time, even it is recommended. A request to the national leaders, we wanted to bring the repertory, we wanted to bring the called as how the pharmacopoeia is there. Indian pharmacopoeia, Ayurvedic pharmacopoeia, Unani pharmacopoeia, United States pharmacopoeia. Even in acupuncture, there is no pharmacopoeia according as per my knowledge. So it is required so that we can bring one pharmacopoeia, we can bring one materia medica for acupuncture. That is a new invention. If the compendium of acupuncture, if anyone wanted to do, and certainly this is the time open, we can bring the compendium of acupuncture on the contemporary of medicine or related to the materia medica for acupuncture. It is recommended. How there are so many books are existing, but however precisely with the research level, we wanted to do as a materia medica. Next please. Then we understand about the dietary technique and meditation. So each and every day, for me, for you, for whole world, the people are recommended. People are required. Once you wake up in the morning, it is duty for me to pray to Almighty Allah. Whoever you have the faith and then religion, please respect and then do the prayers in the morning once you get up. After that you start your work. That always is good for the connectivity to the heaven, and then human earth is connected. Next please. So when we understand about the heliotropic technique is the Taoism, I think this is the sun therapy, how the vitamin D3 is naturally extracted. Next please. Then we understand about the sexual technique of the Taoism. This is a very, very imperative for the married women and married men. It is, of course, we all know the yin and yang joining together is the reproduction. Yin and yang joining together is the balancing. So therefore, joining together today, the people, the women who are suffering for the headache, you remember when the husband is not supporting to the female, causing the migraine headache, the cluster headache, occipital headache, frontal headache, temporal headache. Reasons are different, but still there is the one particular point to be known as a Hui Yin, that is the Ren 1 point. I have given the lecture for 20 minutes by using one single acupuncture point. How beautiful that particular point to be treatable for the male and female problems. Not only doing the sex will be pleasantable, but of course doing the coitus and intercourse, that is in fact is the emotionally impacted each other in the positivity. So therefore we feel joined together, that will be pleasantable all the time. When the husband is required, wife is not giving, wife is required, husband is not able to do certain things, definitely that leads to the migraine headache and other headaches as well. Sorry, if somebody is finding headache, they don't feel that who are unmarried, they are feeling that I need the sex. Of course, after 21 years, it is recommended for the girl to get the marriage. After 24 years, it is recommended to men, boy to get the marriage, so that this conflict and other problems will going to solve. Next, please. So I'll just quickly move neuroendocrine. Next, please. Substance P, local meditation, of course. Next, please. You can have a look, and then conduction electromagnetic signals. Next, please. And then activation of the opiate system takes longer time. Next, please. Next, please. Next. Yeah, I think I have finalized that, but hopefully enjoyed you the class and really implement whatever I told you. It takes lot of time to understand, at the same time implement in our life. So hopefully, and Subratam, he says, no, last Subratam to all of you. Assalamu alaikum. Thank you for organizers giving me the great opportunity to share the certain concept of the acupuncture.
And a special thanks to Professor Dr. Samiullah for his informative talk on acupuncture. After attending his talk, I came to realize that what all studies I made for the last few years is nothing but a big cipher, and I have to start it again. Thank you very much for your support.